Once in a while, as a civil surgeon, I found someone who has had a positive tuberculosis test and their chest x-ray has been abnormal. In one case, this was a patient who had actually even been coughing up blood, but their doctors had never completely evaluated them. This is very serious because it may mean that you have active tuberculosis. This means that the tuberculosis germs are growing within your body and causing disease. If this isn't taken care of, this can be very serious. It can cause you to be hospitalized, and in some cases, it can even be fatal. In fact, tuberculosis is one of the most common causes of death around the world. For this reason, Homeland Security is very definite about what must be done. If someone's diagnosed with active tuberculosis, then the next step is to obtain sputum cultures. You need to cough up phlegm or sputum and have this analyzed for tuberculosis germs. Because tuberculosis germs grow very slowly, the sputum will be cultured for almost an entire month to see if there's any germs present. That's one of the reasons that Homeland Security is so strict on analyzing incoming immigrants for tuberculosis. You can have the tuberculosis germs in your body for many years, sometimes as long as 20 to 40 years before you show active signs of the disease. If you have an active infection, then Homeland Security requires that you have complete treatment before your paperwork will be approved. In most places, the Public Health Department will provide medications for free. However, the medications for tuberculosis must be given over an entire year. In some cases, if you're from an area that may be resistant to standard medications, you may be required to take up to 3 or 4 medications all at the same time to make sure that you get rid of the tuberculosis germs. This may seem like a long time to take a medication, but it's important that you treat it long enough to be able to control the tuberculosis. Your immigration application with Homeland Security will need to wait until you complete treatment if you have active tuberculosis. Homeland Security will not accept your paperwork until you show that you've completed the treatment and you have documentation from the Public Health Department that you actually have completed all of the treatment. Sometimes this is frustrating for patients because they have to wait a long time to finish their paperwork. However, it's also important to realize that finishing this treatment is important for your health and for the health of your family. This is a short delay in the entire process when you think about your entire life and the improved health you'll have from getting proper care.